Good afternoon. I wish to begin by thanking the provincial government for their decision to extend the provincial shutdown in Northern Ontario. I fully agree and recommended it. Ontario is experiencing an unprecedented increase in the number of cases, deaths, hospitalizations, critical care admissions, and patients on ventilators due to COVID-19 infections. Over the last 14 days, we have seen 41 individuals test positive for COVID-19 in our district. We currently have 23 active cases, and we're just starting to see the negative impact of the holiday season. Our local hospitals have very little surge capacity and limited resources, which we need to and must protect for everyone's health and safety. Our health unit district is unique, as it is the only health unit to border Southern Ontario. Past experience has shown that people in areas with more restrictive measures in place will travel to areas with less restrictive measures, which increases the risk of spreading the virus. Having the same restrictions throughout all of Ontario will help reduce travel and that risk. For these reasons, I support the Government of Ontario extending the provincial shutdown by 14 days in Northern Ontario. I am also in full support and recommended schools in Northern Ontario resume in-person learning. Now, I can understand that it can be confusing as we are saying stay home and only go out for essential reasons. I believe school is essential for our children's mental, physical, and social well-being. Many students in our area face barriers to online learning, including access to reliable internet. For some students, school is a safe place from their home or the place where they receive meals that they would not have at home. For parents working while balancing an online curriculum can be difficult. In some cases, parents and some that provide essential services may need to give up shifts to stay at home with their children, which can add financial stresses to an already challenging situation. To date, the health unit has not seen spread of COVID-19 in elementary or secondary schools within our district. There have been no outbreaks, and the school environment has not contributed to any community spread of the virus. With the current infection prevention and control measures in place, returning to school presents as a low risk. This means the benefits of in-person learning outweigh the risk of COVID-19 at this time. However, we need to monitor the situation closely, and if circumstances change, we will adapt and take appropriate action. The shutdown extension is a strong reminder that we all need to step up, act now, and slow the spread of COVID-19, as we successfully did during the first wave. Think hard about the decisions you are making. By acting now, staying home, and following the shutdown rules, we can help save lives, slow the spread, reduce the burden on our hospitals, keep in-person learning, and hopefully open our businesses again soon. However, the key is we must all work together. So now I will be answering some questions submitted by the media. From Eric Thompson, extending the northern lockdown while also sending students back to school for in-class learning doesn't seem to support the messaging that everyone should stay home when possible, since online classes remain an option. Does telling parts of the population to stay home help slow the spread of COVID-19? As mentioned before, to date, the health unit has not seen transmission of COVID-19 in elementary or secondary schools. This means the benefits of in-person learning outweigh the risk of COVID-19 at this time. However, we need to monitor the situation closely, and if circumstances change, we will adapt and take appropriate action. From Chris Dawson at Beta Day. How much of a priority is it for the health unit to continue to protect long-term care homes in the region? Will staff and residents get vaccinated first in our region, and when do you think that will happen? Thank you for that question, very important. And I'm glad we have the opportunity to update you on that. Protecting the residents and staff in long-term care homes, retirement homes, is a priority for our health unit. When the pandemic started, we closed visitor access to long-term care homes a day before the province announced their closure. I saw the need to protect this vulnerable population, and I continue to see the need. We have to prioritize the health and safety of those most at risk. This is one of the many reasons why the extended shutdown is so important. Vaccinations will take place as per the provincial rollout. Long-term care homes, retirement homes are at the top of the list. The health unit has been working with our community partners and have a plan in place to begin immunizations. At this time, vaccine is not available for our district. There are limited supplies, which are going to areas with the greatest need. We have to be patient. Once we know when the vaccine will be available locally, we will let the public know and we'll begin immediately. From Chris Dawson at Beta Day, are you hoping police and bylaw officers will crack down on gatherings with the numbers ramping up in the region? First of all, I want to thank our local police services, city police and OPP, bylaw officers, and everyone who is working to help enforce the rules under the shutdown. I believe that there are strong efforts happening locally, and I'm confident that everyone will continue to work together to enforce the rules. I also hope that enforcement isn't needed because our citizens have put the health and wellness of our community above the need to have gatherings and break the rules. From Chris Dawson, Beta Day, is there a chance we could get Southern Ontario COVID-19 cases transported and treated here in North Bay or other areas of the North? What is your take on this? Well, Southern Ontario ICUs at maximum capacity may be moving COVID-19 and non-COVID-19 cases to ICUs further north. At this point, cases will only be sent as far north as Barrie, but that limit could be revised if the number of patients requiring ICU beds continue to grow. Due to this, we must do our part to help reduce the burden on our hospitals by following public health measures and staying home except for essential reasons. Mo Fahim, Moose FM. Yesterday, the health unit confirmed that positive case number 162 was an individual in the age group 60 to 79 years and was outbreak associated in terms of exposure. Is that case a resident or staff member at Lakeland Long-Term Care? And if so, have you done any asymptomatic testing at Lakeland? Thank you for that question. Aligning with the Ministry of Health guidelines for an outbreak in a long-term care home, a COVID-19 outbreak was declared based on a single lab-confirmed case in a staff member of the long-term care home. We don't speak about the cases individually due to privacy concerns. The line listing on our website may include cases that are associated with outbreaks declared both within and outside of our health unit region. Additional testing is underway among residents of Lakeland, and we're working with them to manage this outbreak. Mo again from Moose FM. With the province extending remote learning in south of Ontario, and the past 5 days seeing an increase in those 19 and younger testing positive for COVID-19, are there any plans for asymptomatic testing in schools, and how does in-person learning affect the shutdown extended to the 25th of January? In the North Bay Prairie Sound District Health Unit region, in-person learning for elementary and secondary school will resume on January 11th. In regards to testing for school-age students, the health unit will recommend testing in schools when it is required. At this time, the health unit has not seen transmission of COVID-19 in elementary or secondary schools. Increases in the number of school-age children testing positive within our district has been as a result of spread among family members. This was considered, and we determined that the benefits of in-person learning outweigh the risks of COVID-19 at this time. However, we need to be flexible. If we see a trend of transmission happening within the schools, I will take appropriate action. Tom Mangos, Radio Works, Prairie Sound. Do you think pausing the color-coded COVID-19 restriction level takes an individual community's focus off of trying to do better to achieve a safer level, and instead throwing in the towel and simply saying, oh, well, we're all in shutdown now, what's the point? Especially considering the spike in cases since the shutdown. Well, I really hope that people aren't thinking, oh, well, we're all in shutdown, what's the point? I hope that the public sees our increasing cases and thinks, wow, we're in a serious situation and we need to follow public health measures. I would hope that people realize that the numbers are not going in the right direction. And the situation is critical. Today, the province had over 4,200 people test positive for COVID-19. This is serious. We hope that people will follow the rules and help reduce the burden on our hospitals and help to keep our vulnerable populations safe. If we don't act now and reverse the trend, it is likely that the shutdown will be extended even further and possibly with more restrictions. Sarah Bissonnette, North Star, Parry Sound. Many recent cases are connected to close contact of a case. Is that connected to social gatherings, workplaces, or homes? Reviewing case histories, it seems most of the cases are related to close contact in household settings, those living in the same household. But social gatherings, meetings between households has contributed to that spread, and it has to stop. Sarah Bissonnette, North Star. What is one thing you hear often that you wish people would stop thinking it is okay? Such as, I just stopped out of my friends for a moment. I wish people would stop thinking they can ignore the rules. Every time you do that, you're putting yourself and others at risk. When you look for loopholes, you are making the decision to find ways not to stay home and not to distance. This increases the risk to yourself and others, and especially your loved ones. Sarah, again, what can you say to parents whose children are in-person learning about schools reopening while the lockdown is extended? The two don't seem to mesh. This is a very popular and important question. It really comes down to a risk assessment and determining what is essential. School is essential. Learning is essential. And the mental, physical, and social health of our children is essential. Online learning has many barriers to individuals in Northern Ontario. And to date, the health unit has not seen transmission of COVID-19 in elementary or secondary schools. This means the benefits of in-person learning outweigh the low risk of COVID-19 in the school environment at this time. However, as mentioned before, we need to monitor the situation closely. And if circumstances change, we will adapt and take appropriate action. PJ Wolfson, North Bay Nugget. With the province informing hospitals that patient transfers may be necessary to other reasons, is the local health unit involved in the local process? And if so, what special precautions will be undertaken if patients are transferred here from, say, Toronto or Windsor areas? The health unit has worked with hospitals since the beginning of the pandemic and for years before, and continue to do so. And I am confident that all the appropriate infection, prevention, and control measures that need to be in place are currently in place for that eventuality. PJ Wilson, again, with the recent rise in the number of COVID cases in the health unit region, is there a concern that the spread is getting out of control? Are there any other measures beyond those already implemented to try to stifle the growth, for example, local curfews? That is a great point, and I am worried that people are not following the rules and that people are looking for loopholes. If we continue to see an increase in the number of individuals testing positive in our region, I will have to look at all available options to slow the spread of COVID-19 locally. Brad Oben, Moose FM. As the area's Chief Medical Officer of Health, what do you tell parents when they ask us why their children can go to school but they can't go to work? Individuals are encouraged to work from home when possible. When this is not possible, they may go to work in person, but are required to follow public health measures. Students may also return to in-person learning as of January 11th. And if we see a trend of transmission happening within the schools, I will take appropriate action. Brad Oben again from Moose FM. What do you believe has led our area to its all-time high in active cases this week? Almost 20% of all of our total cases in the last week or so. So after reviewing case histories, it seems that most of the cases are related to close contact in household settings, those living in the same household. But social gatherings, meetings between households has contributed to that spread. Thank you for all the great questions, and let's all work together and act now to help slow the spread of COVID-19 and save lives. Thank you.